Get to this now. South Africa is in the grips of a second coronavirus wave, and today we're seeing an increase of over 8,000 new infections. But could that number be even higher? Well, the HSRC is trying to find out through a national antibody survey, and it hopes to reach those with mild or no symptoms who were never tested. So let's discuss this with the Council's Sizulu Moya. Sizulu, thank you so much for your time and welcome to the South African Morning. I'm keen to hear more about what your findings were, but let's start with according to your findings and research, what you found particularly around the spread of COVID-19 and this virus.
Thank you. Good morning to you and to your viewers. Thank you for the opportunity to speak about our work. So just to take you back a little bit, this work is still ongoing. We haven't yet come to the point where we can tell you what our findings are. We started this work at the beginning of January, and precisely to the point that you made, that some people get infected with COVID-19. They may be asymptomatic completely. We know that some may have mild symptoms. We know that some may have severe symptoms, and they may end up being tested and being in hospital. So those people may have mild symptoms. Those who may be asymptomatic, we know that they are also infectious, and we can confidently say that of those are the ones who actually continue to spread the infection, especially if they are not adhering to the preventive measures that have been put forward. So what our study seeks to do is to get a clear picture of how far the infections have spread across the country. We are doing it at a household level. So we're not only targeting those people who feel unwell and go and get tested. We're going to people in their homes, to where they live, people who may not even know that they may be infected, some of them because they are asymptomatic. And because we're doing antibody tests, we'll be able to tell that so-and-so was infected.
Yeah.
The way in which we're approaching this is through a statistical approach that will give us a national picture across the country as to what is happening in terms of infections. We, in addition to doing the blood tests, we are also doing interviews. In these interviews, we ask about behaviors. We know what we're supposed to do in terms of preventing ourselves contracting the infection and also spreading it to others in the event that we are infected. So we also include that. We'll be able to tie that in with what the antibody testing will then reveal.
Right, and just to come in there, we have around over 59 million people in South Africa. How many people are you targeting in terms of those household community members and going into their homes and conducting this survey?
So from our statisticians, we determined that we can get a representative estimate from about 19,000 people. So we're targeting precisely 19,600 people across the 9 provinces of South Africa. We are looking at people at 12 years and older in all these areas that have been selected for participation.
Right. And also because the health minister has just announced a second wave, will you be planning to conduct a second survey to sort of monitor the second wave?
So our survey is to monitor the epidemic as it evolves. We would have liked to have done this a bit earlier, but setting up a survey of this kind, we would appreciate, takes a lot of time, a lot of preparation, and we work with quite a lot of partners to set the systems up so that we deliver work that is credible and that is accurate. Our work will be done in 2 waves. So what we are doing now, we're calling it wave 1. It will be for 8 weeks, ending at the end of December. And then we're starting another wave in January, which will end in February. So we conduct it in 2 waves. So we'll be monitoring what has happened at this period, and then after a 6 to 8 week period, then what the status will be in terms of the infections in the country.
All right, then, Sizulu Moya, I look forward to, of course, once those findings are finalized, and hopefully you can come back and share those results with us. But that's where we leave our conversation. Thank you.